Welcome to the Wallace Red Show. We have a very interesting show today. Wallace Red is a bit under the weather and won't be able to make it, but I think that we can carry forward. I think we'll be successful, as our topics are always interesting. And today our topic is something that we all can identify with and something that we all need, and that is affordable health care. We're going to talk about H.R. 3962, which is the House bill, or the apartment, which is the law of the land. We have a very important guest that's, that is going to assist us and help us to understand what the Affordable Health Care Act is. Her name is Tara Maxwell. Tara, are you on the line?
Yeah.
Go ahead, Carl.
Yes, I'll let you get into the show. This is Alan. I got to speak about the health care. I'll let you get into the conversation.
Yes, hold on, Alan. We'll get right back with you. We are waiting on a phone call to come through from Baltimore, Maryland area. Ms. Tara Maxwell, who is an expert on the Affordable Health Care Act and who is much sought after in the United States to explain to the American people what the affordable health care is. Before we open up lines for the general public, I'm waiting on her to call in. Until she calls in, rather, we're just going to talk about the Health Care Act in itself. But politically, the Health Care Act is a bouncing ball, and it's being tossed all over the place, and mostly to discredit President Barack Obama. As you have heard many times from the Republicans and the extremists in the Republican Party, as they attempt to beat down this president and discredit him for everything that he's ever brought forward, understand that they are at war against President Barack Obama. As far as the Health Care Act is concerned, they are beating him down as far as they can because of a website. They're saying that the website doesn't work. Well, I went on the website this morning and it works just fine. I was able to go through a number of sessions on the website. However, me being a veteran, I don't have to register. But if I had to, I would have had a great opportunity to do it this morning. So the website is not the reason for us or for the public to feel down, because actually you have 4 ways to apply for your health care. You can apply online, yes, and online is one of the president's pet peeves. You know, he's internet savvy, and he loves to present whatever he can over the internet. And the online registration is an opportunity for many of the young people to go on to use that website to register, and the website, as I found this morning, is basically seamless. And it's quite easy to use, very easy to use. Being that President Obama is a savvy internet person, the Republican extremists attacked him in what he wanted to work himself. He wanted the online registration to work for the American people. And they targeted that and attacked him over and over again about a website. Mind you, the Affordable Health Care Act is the law. It is not something to play with. It is just as much of the law as the Constitution is. So it's not going anywhere. It can't be repealed. The only way it can be repealed is that you have an extremist Republican group over the lower house and one over the upper house, and the president himself would have to be an extremist right-wing Republican fanatic. That is not likely to happen. America is a progressive country, and the people are moving forward for those changes that are fundamental and basic to the American way of life. And that is going to happen. So the thing about it is, regardless of what the Republicans say in Washington, regardless of how much they hold back, there is nothing that they can do to repeal this law. Now, back to the 4 ways to apply. The next way to apply is by phone. You can just pick your phone up and call in. The number is 1-800-318-2596. Just pick the phone up and call in. No big deal. The other way you can do it is through, the third way is in person. You can go to a navigator, someone that knows how to use the system to assist you, who is, by the way, is certified or could be certified. You can use an application assistant. You can use a certified application counselor. Or you can go to your government agencies and make application. Or, and finally, you can make a paper application. So, out of 4 ways of applying for affordable health care, the Republican radicals are attacking the website. They are attacking a website, and they are using extremist language. They are saying things like the problem with the website is the worst thing that has ever happened in American history. Can you believe that? Can you believe that these people are tying a website to such an extreme idea or concept about our American way of life? The website is just a tool. It's not going to affect people enrolling into affordable health care. Now, the first thing we want to mention to you about the affordable health care is, or probably the next set of information I want to present to you about the affordable health care is your income and plans. Now, the reason why I believe that affordable health care is important in our region, the Memphis region, the Memphis statistical area, the Memphis economic statistical area, which includes North Mississippi, East Arkansas, and West Tennessee, is because of our income level. Our income level is the lowest or among the lowest in the United States of America. So we'll be the ones who mostly benefit from the Affordable Health Care Act. We'll be the ones who would be able to appreciate the Affordable Health Care Act. As you know, most poor people, because they're not able to afford a doctor or a medical plan or anything like that, they wait until they get extremely sick and then they go to the emergency room. In other words, most poor and lower income or moderate income families have to wait to go to the emergency room to obtain health. And when they leave the emergency room, they still don't have a doctor to go to. If they get sick again, they have to come back to the emergency room. Well, the Affordable Health Care Act ends that. You will be able to have your own doctor. You'll be able to get the care that you and your family needs. You'll be able to get the health care, dental care. You'll be able to have follow-up. You'll be able to have and develop for you and your family affordable health care and good health care. One of the things about the affordable health care is the income level. An example to that is this. The example is this. The lower your income within the range shown in one of the columns they have, the lower your premium cost will be. An example is, if there are 5 people in your family and you make $25,570 to $110,280, then you would benefit tremendously from the Affordable Health Care Act. And from what I'm seeing on the chart, basically, if you make under $39,630 and 8 members in your family, you're going to benefit tremendously. So what we have in Memphis and the surrounding area are people who primarily make less than $19,000 a year. And in many cases, those people, not only would they get a good premium price for their insurance, they're also going to get a tax credit. So in other words, this health care law is going to benefit low and moderate income families. And the other thing is, the law just doesn't apply to the United States. It also applies to the United States territories, the Caribbean and the islands, Puerto Rico and places like that too. So the Republicans are saying they don't want it. Why? Because they don't want to do a thing to help low-income families. They don't want to do one thing, not one thing to advance the progression of America. Not one thing. They want to pretend that the United States government is broken. Why? Because a black guy is in the White House. They want to pretend and create the illusion that this president is the worst president we have ever had in the history of presidencies. And it is not. He's a great reformer. This health care bill and health care law is the New Deal of our era. I hope you understand what I'm saying. This is the New Deal of our era. Finally, Americans are going to be covered. And it's not going to be expensive to be covered. Everybody is going to be covered. Now, consider, if you're on Medicaid, Medicare, CHIP, you have a job plan. In other words, you have insurance through your job. Or you bought your own insurance somewhere. Or you have COBRA, retiree coverage, TRICARE, or VA health coverage. You are already insured. You won't have to register. You won't have to pay the penalty for not registering. You're in. So you won't have to be bogged down in the website and all of those different things is of no concern of yours. The concern about the website is a concern of those people who don't have health care coverage at all. Now what I found in the health care was pretty interesting is the different types of the plan. You have a catastrophic plan, a bronze plan, a silver plan, a gold plan, and a platinum plan. The catastrophic plan covers 60% of your costs. The bronze, 60%, silver, 70%, the gold, 80%, and platinum, 90%. So when you go online and you choose a plan, or decide to choose a plan, you'd have to select one of those plans. If your income level is extremely low, you'll get a tax credit. You don't have to worry about it. And most of all, hold on one second, Alan. Most of all, your premium is going to be low. Okay, Alan, come in. How you doing?
Yeah, about that affordable care act. You explain that to a T, brother. What's your name, sir?
My name is Talut.
Out today. I didn't get your name. I turned in a little late. What's your name, sir?
Talut.
Talut, check this out. You know when Franklin Roosevelt, when you were speaking about the New Deal, and
yes.
you're a smart guy, Franklin Roosevelt was making it affordable for senior citizens to have dignity and to have a decent income when they grow older. Check this out. Because Obama is threatening, our compassion. See, Republicans, they care about money. I try not to pay the full benefit. They kind of cancel your policy, or they find like kind of bureaucracy not to pay the full amount. Look at some of these policies. And senior citizens need medication the most, because when you get old, your bones get fragile and everything. That we have to have compassion. When the insurance industry started, they considered African American people as cattle and chattel. They didn't want us to be a part of the equation anyway.
That's right.
Saying that compassion is good. That's why they were. But you still have to take in consideration the cost factor. This is why I said when senior citizens are not able to go to a doctor, when a senior citizen is not able to get their medication, it put burdens on their family. That's what government is for. It's like it's the lender of it's the avenue for last resort. Most people should try to get private insurance because they got laws to combat discrimination. That the insurance company, and I said this because I know about that, they're not concerned about compassion. They're concerned about making money and profit for the bottom line.
That's true, Alan.
We have come a long way. Ben Carson said he compared Obamacare to slavery. Slavery, the insurance company considered people brown like you and myself as cattle and chattel. So we weren't even part of. We weren't even thought of. So look how far we have come. This is what I'm saying. If Franklin Roosevelt had compassion for the elders, disabled people, President Obama had compassion for people who can't afford insurance. That's why I got Affordable Care Act. That's what I said. But you still got to get off your rusty jumpsuit and help President Obama rather than looking for him to do all.
Well, Alan, I think it's more. Alan, I think that it is more. Get off your rump and help yourself. Right. And what you're dealing with is you're dealing with your own health care. You're dealing with your own health, and you're dealing with the health of your family. So people have to just get up and realize that a website is not it. That's a political football that's being played with. But the fact is, the Health Care Act is the law, and it's not going away. So everybody in America and its territories are going to have health care. All right, Alan, thank you so much for your input. I'm going to open the lines back up so that we can get Miss Tara Maxwell in, and you're welcome to call back. Now, I want to take time right now to pay the bills. We have Alan Walker at 1211 North Hollywood. He's the time man. The time man. He's the one that can help you with your tires. He's the one who will come and assist you when you have a flat tire somewhere. He has good quality tires, and he's one of our sponsors. And I would like to thank him very much for making sure that the Wallace Red Show continue, and that the Wallace Red Show is a show where you can actually get good information, like information about the Affordable Health Care Act. And I want to give thanks to another one of our sponsors, the Marcus Garvey Institute, located on the corner of Lauderdale and Parkway, an historic child care institution. You should stop by there. You should greet the facilitators and administrators. You should take time and show that men and women who dedicate their lives to educating our children are a necessity, and we need to keep them in the forefront. And we need to support them and make sure that they're able to generate the revenue and the income to continue and progress forward to give our children good quality education and child care. Lastly, I want to mention to you a great sponsor, one of the greatest, and that's Sister Desi X. Sister Desi X has a daycare center on the corner, on the one block north of Chelsea on Danny Thomas. She's been in the child care business for I know a greater part of 20 years. There's one thing that she knows, is children. And we want to thank her for her sponsorship, and we want you to stop by and give her a visit so that she can also acknowledge that the community is with her and the community begs her. So y'all stop by and visit Daisy X, Marcus Garvin, and Alvin Walker. At this time, we're going to make a transition as we, hopefully our guest will call in, Ms. Tara Maxwell. But if not, we're just going to move forward. And what we're going to talk about now is Memphis politics. You know, the question is, why hasn't our political leaders addressed this issue? Why haven't they presented to us the leadership on the Affordable Health Care Act? Why haven't they had community forums and community meetings to help educate us about the Affordable Health Care Act? Is it because they're too lazy? Is it because they're not interested? Or is it because they don't care? It is of my opinion, they do not care. Especially our black political leaders in Memphis, Tennessee. I'm on the attack. I'm on the attack for a reason. And that reason is, whatever they have put on the floor in Memphis, Tennessee has not worked for us. We are still in a deplorable condition. We still need jobs. We still need good housing. We still need good police protection. We still need small business to be able to grow and develop. We still need good thinking men and women in political office who are about the progression of Memphis, Tennessee. We need these things. How do you suppose we're going to become a city of the great? How do you think that we're going to survive as that great city on the banks of the Mississippi River? Do you know at one time in our past, our recent history, 30, 40 years ago, we were in competition with Atlanta, Georgia. We were racing neck to neck with Atlanta, Georgia. Now we're nowhere in the running with Atlanta, Georgia. As I travel across the United States, there are cities who are far more progressive than Memphis are now. Cities like Birmingham, Alabama, Jackson, Mississippi, Nashville. Cities that used to look to Memphis for leadership. Not anymore. We have regressed. What do we have to offer? Beale Street, a watering hole as an entertainment center. We boast about Beale Street being the biggest and the greatest tourist attraction in Tennessee. But that money on Beale Street never trickles down. The small black business or the small business person in Memphis never gets a dime. That money goes into the pocket of the rich and the wealthy who are primarily white boys. They get the money. But we boast, oh, Beale Street brings in X amount of $1 million in taxes. We don't ever see it because our city just asked us to vote for an increase in sales taxes. So obviously, the money is not making it to the coffin because they need more money. The problem with Memphis is one problem: bad leadership across the board, from the mayor's office to the city council to the county commission. Poor leadership. I don't care about you being Democrat or Republican. It's poor leadership. You're not doing your job to take care of Memphis and Shelby County. The United States, as the Republicans say, they say it's broken. I say no. Memphis, Tennessee is broken. It is broken. It's a city of 600 and some thousand people. And it's broken. Its metropolitan statistical area includes perhaps 1.2 million people. This is the regional seat of power. It is the county seat of Shelby. It weighs as tremendous power. But our politicians have misdirected our money. They chose to put money in frivolous things, like the pyramid, like Mud Island, like the big FedEx Forum down there, like the Beale Street landing. Put billions of dollars in those projects over the years, and they are yet to generate any kind of revenue. Any kind of revenue. And as the talk in the street is, if the Grizzlies decide to leave, and I think they're trying to bait the Grizzlies, the mayor and his office administration right now, with surrendering Beale Street over to that administration down there of the Grizzlies to try to make sure they stay here. But the thing about it is, really, the taxpayers are not getting any benefit from those billions and billions and billions of dollars. The only somebody who have benefited from those billions of dollars spent out of our treasury throughout the year are the white boys. See, in Memphis, you have a psychological problem, and it has to do with the imaginary white man. Our political leaders, the black ones and the white ones, the Democrats and the Republicans, they truly believe in their hearts and in their souls that the white boy can do a better job. The white boy can actually manage better. Case in history, they all have failed. Not one of them who took those projects that I mentioned earlier were successful. Or was successful by me. Not one of them. They fail over and over and over again. Yet, our black politicians would not put one project in the hands of a black man or a black woman. Not one. Not one in the history of Memphis, Tennessee. Not one project has been managed by somebody black. Always the white boys. Crisp, sharp, eloquent speakers, sharp points of view. But they have all failed. Every one of them. And guess what? That idea is as fresh today as it was 40 years ago. Our mayor, our city councilmen, our county commissioners would put every major project that comes before them in the hands of the white boys. And the white boys are going to do exactly what they did the last time. Take the money and run. What we need in Memphis is a complete overhaul of our political system. We need to kill the one that's there. Get us out of the Crump era political system. We need to remove the whole system. We need to vote everybody out. And we need to comb our communities and our neighborhoods for good leadership. I want to thank you. And I hope Brother Wallace read as well. And I pray that this show was an interesting one for you. I look forward to seeing you on the next time. And have a great Sunday. Love you. Peace.